What I want to do is I want to displace the ability to decide what's true from, is it published in a peer-reviewed journal, to essentially democratization of science, where scientists themselves, by checking each other's work in a collaborative way, where people are rewarded for being replicated, for being subject replication, determine what's true.
We believe efforts to stifle heterodox thinking are not only wrong from an academic freedom perspective, but harmful to the open and even raucous discourse required for the healthy functioning of a democratic society. Gentlemen, please don't be too raucous today, but we're all looking forward to listening in on this conversation. Welcome again, Dr. Bhattacharya and Dean Yeomans. You've got the floor.
I was an inadvertent activist during the pandemic. I was a professor for 25 years at Stanford. I did a study very early in the pandemic asking how many people had already had COVID. And back then I wasn't thinking about it as a radical act. It was just what I did as a professor. The Great Barrington Declaration happened in part because I decided that I really needed to speak. I had done a lot of research about what was happening to the poorest people in the world. The economic dislocations of the lockdown had caused tremendous damage. The World Food Program estimated 130 million people were on the brink of starvation as a consequence of the economic dislocation of the lockdowns. The schools were closed. In my native state of California, my kids hadn't seen inside a classroom didn't see inside a classroom for a year and a half. And the Great Barrington Declaration actually was just, it's the most, I know it's, I'm known for this, but honestly, it's the most unoriginal thing I ever wrote in my life. It says protect older people better, protect vulnerable people better, right? Don't harm people who aren't particularly vulnerable. Those were the two ideas. That's how we managed previous pandemics. I was hoping that it would elicit a debate. It would cause public health to have a raucous fight, actually. What I didn't anticipate was the repression of it. I still to this day will never get over the visceral gut punch that felt like. It was essentially an attempt to end the discussion, end the debate, end the reasoned conversation we should have been having over the right policies. The pandemic, I think, if you asked me what the biggest mistake that public health made was that it opposed free speech wholeheartedly, right? It decided that people questioning public health dogma was too dangerous to have happen. The counter-argument in public health is that if you have a dangerous situation like a pandemic, and you speak up against what public health is doing, you'll undermine, especially with some authority, you'll undermine public confidence in things that are known to work to mitigate the harm from the condition. Smoking is terrible for you. Right? Now, if I, as the director of the NIH, were to come out and say, well, I don't know if smoking is bad for you, who knows, sometimes, well, I will have committed a sin, a public health sin. Right? And that's because the scientific consensus on which we understand smoking to be cause lung cancer, heart disease, emphysema, all that is absolutely rock solid. Like, it's replicated, really, really well-known knowledge. It's not science that decides whether you should or shouldn't smoke. That's you. There's philosophical systems about what the range of your human liberty should be. But no real philosophical system I know of says science should determine all of your human liberty. Right? You still get to make choices. So I think science is incredibly, vitally important for basically everything to do with physical reality. But that is only one input into deciding how we ought to live our lives. Science doesn't get to decide how I value the freedom of my children versus my freedom. Right? That's a personal decision that ought to be in the personal space. It's not science that decides that. The problem with the pandemic is that you had a brand new virus floating around. You had an absolutely unique sort of circumstances around it. The science was very far from settled. So whatever moral basis you have for saying we should suppress dissent did not exist. Right? The necessary free speech in science is absolutely necessary because it is the corrective to ideas that are incorrect. And especially for ideas that are held to be correct by scientists, you have to allow for free speech to happen. The norms of science are different than public health. it's absolutely required that people be allowed to disagree with each other.
I think that the Calvin principles, the Chicago principles for free speech for institutions is, I don't know how you go to university without it. When the university leadership weighs in, essentially what that means is it sends a very clear signal. Here's the range of acceptable thinking. It is important, nevertheless, for the university leadership to stand up for the mission of the university. If some action threatens the mission of the university, that's when the university should step in, the leadership step in. But if it's outside the mission of the university, then let people talk and discuss and debate. I think that's what the university is for. Even in my role, there are limitations on what I really ought to do as a NIH director. Whereas as a professor, that role should have been pretty wide. I should be able to take almost any position I like. Again, as long as it didn't threaten the mission of the university.
I'm really proud of essentially reminding the researchers of the country of our obligation to use our taxpayer money that we are gifted with for the purpose of improving health, rather than achieving some political goal that's not within our scope or mission. Right, so a lot of I think it's vital that the NIH invest in research that improves the health of minorities. But alongside much of the rest of the United States university systems, we got caught up in this sort of like desire to achieve social justice through our funding. The NIH has this mission to support research that improves health and longevity of people. We absolutely should do that for everybody. We should do that for minority populations, for women. It's vital that we do that. You can't make America healthy again unless you do that. But yet so many of those investments that we made in DEI had no hope of actually doing that. They were a political project rather than a scientific project. The measure of my success as an NIH director will be if we look back 10 years from now that the research that we invested in over the time I'm director resulted in improved health for people. If you go back to the 1980s, the age at which NIH researchers would win their first large grant was in the mid-30s. Today, it's the mid-40s. The culture of biomedicine has become essentially a place where it's very difficult for your early career research. We punish failure too much. You do a postdoc, you don't get a cell paper or something, and all of a sudden you're out. And this really matters for innovation because it turns out that it's early career researchers that are most likely to have the newest ideas that they try out in their research. If the first year after your PhD, that's when your first paper you publish out of your PhD, that's when you're most likely to try out a new idea in your work. And then for every year that you age, a researcher ages, the age of their ideas and their papers also age by about a year. If you do replication work for a living, you have no social status among scientists, right? And part of the problem is you can't get NIH grants. You can't publish your papers, right? Because you're not doing the shiny new thing. I already made the case we need early career researchers to do shiny new things, but that means that we even more need replication to see if the shiny new things are right. And actually, it's not even one of the problems is like right now people view replication as a threat, right? If someone comes to me and says, I want to replicate your paper, I assume they want to destroy my career. Right? Einstein doesn't become Einstein until his ideas are put to the test. Typically, the things that are published, the effect sizes are much larger than the replication studies find. The studies themselves are not, the data aren't shared. They're not like, the methods aren't written in a way where replication can even happen. This has real implications for everybody. Even though it's published, and peer reviewed, you don't know if the answer in the paper is right. You look up the, if you're a doctor, you're relying on published biomedical literature, and yet the published biomedical literature isn't right. It's why you get all these like reversals in medicine. It's actually an epistemological problem. The key thing is, how do you decide what's true? And the problem we have now is that we have authority in the form of, I published a peer-reviewed paper, getting to decide truth in physical sciences, rather than what we really know to determine truth, which is other people looking at the same idea tend to find the same answer. So we're going to start funding people to do replication work. The key thing there is it can't be the government that decides what to be replicated. It has to be crowdsourced. It has to be the scientific community itself has to determine that. Second, we're going to have a journal where you can publish your replication work. And this is the key thing that will launch the second scientific revolution. It's a humble thing. When you search for a paper, instead of, you'll have a button, a replication button. You click the replication button and all the related relevant replication results will pop up right next to it. So you can decide, is this result actually true by looking at the summary of the replication work. The replication button itself that I told you about, the key to the second scientific revolution, that's going to be AI enabled. Right? How else do you summarize vast literatures at the click of a button? There's a scientist named Max Perutz. He was a University of Cambridge biologist in the 40s, 50s, 60s. He had this idea about he was going to figure out the structure of myoglobin. But the problem was he had these very primitive tools for figuring out the structure of proteins back in the 1940s and 50s. And he spent 10 years as a student trying to figure out the structure of myoglobin. All his professors were like, Max, what are you doing? You're a smart guy. Just do an easy problem and move on with your life. But he just kept at it and finally figured it out. Then figured out the structure of hemoglobin, or contributed to that, which is a much more complicated molecule, and then won the Nobel Prize in 1962. A decade of essentially failure, and yet he was allowed to encouraged to continue along, and he would not leave his idea behind. What I would very strongly recommend is be ready to make a sacrifice for that idea. Because that's how you change the world, right? It's not by looking around, seeing what other people's ideas are, and then try to fit in with those ideas that you change the world. That if you don't invest in yourself in that way, you'll look back in regret rather than in pride.